What's up, everyone? This is Larry with Yunique Medical, and today I want to talk about men's health. It is No Shave November, and as you can see, I stopped shaving a couple of days ago. I actually had to shave it completely off so that we could start some regrowth and it all be kind of even. So I'm rocking that. So men's health, if you look on my website, I do have a little article on a men's health ultimate guide, and we're coming out with a blog this week on testosterone therapy and myth busting. So that's what I want to talk about. As some of you know, some of you may not know, I do a lot of testosterone therapy in men as well as women. But there's a couple of things that commonly come up that scare my clients. And the two things that I hear the most are, does testosterone therapy cause prostate cancer? And can testosterone therapy cause cardiovascular disease? And those are actually two myths that have been debunked a while ago, but most people don't know that. And definitely the pop culture doesn't know that, the average person. And even some doctors out there in primary care, they don't know it as well because it's not their area of expertise. So what I want to do is I want to actually show you the research. Now, I've never used this Zoom thing officially before, so just bear with me. So I'm going to share my desktop and put this guy over here. Okay, so article numero uno. All right, so here's a good article. Actually, this is the article. Comes from, as you can see, the Mayo Clinic, and it's titled "The Fundamental Concepts Regarding Testosterone Deficiency and Treatment." And this is an international expert consensus. This isn't just some local doctor sitting around talking about it. This is a world consensus. So Dr. Morgan Taylor, you can see he's the first name on there. He is a urologist and an absolute guru of testosterone therapy and its research. So we got together all these people to talk about, and there's PhDs in here, docs from all over, and all they did was talk about testosterone therapy and its use. And this was back in 2015. You can see right here, but they do an update that I'm going to show you here in a second. So the abstract was to address widespread concerns regarding the medical condition of testosterone deficiency and its treatment with T therapy. So I won't bore you with all the details, but I do kind of want to just show their conclusions and read them to you so that you understand. So TD, if you look at number one right here, testosterone deficiency is a well-established, clinically significant medical condition that negatively affects male sexuality, reproduction, general health, and quality of life. So right there, we should be talking about it more with our male patients. We have no problem talking about hormone replacement with females, but us men, we kind of get, left to the sidelines until we're so symptomatic where we get desperate. So then number two, it says symptoms and signs of testosterone deficiency occur as a result of low levels of testosterone and may benefit from treatment regardless of whether there is an identifiable underlying etiology. So that means somebody could benefit from testosterone therapy even if they don't have a primary or secondary cause of it that's a typical diagnosis. So number three, testosterone deficiency is a global public health concern. Number four, testosterone therapy for men with testosterone deficiency, it's effective, it's rational, and it's evidence-based. Number five, there is no T concentration threshold that reliably distinguishes those who respond to treatment from those who will not. So this is where you'll go to, your doctor's office, or someone will say, "Hey, you have normal testosterone." And say, "Hey, bro, that may not be normal for me. I don't feel well. I have symptoms." And we'll get into what those symptoms will be in just a second. So that means we shouldn't be following necessarily numbers, but use them as a guideline to see how therapy is working and ultimately find where an individual person feels the best. So I may have a guy that loves his testosterone at 1200 total. And then I have other men that are perfectly fine at 800 once we get it there. So there is no set number. It's individualized, based. Okay. So enough on that. So number 6, there's no scientific basis for any age-specific recommendations against the use of T therapy in men. So this says you don't have to be 65 years old to get testosterone therapy. You can be 35 and positively benefit from testosterone therapy. Now, for me, as a personal rule, I don't use testosterone exogenously, which means I'm giving you actual testosterone in men 20 to 30, 20, maybe 20 to 35. And a 20 to 35-year-old, we can employ other tactics to increase testosterone levels because they're young enough to do so. After the age of 35, we start talking about, okay, using exogenous testosterone if they've had children already, because you can suppress an FSH, which stimulates sperm. And I have a whole soapbox about that I won't get on right now. Number 7, the evidence does not support increased risk of cardiovascular events with T therapy. Period. Did you hear that? No increased risk of cardiovascular events. The media jumped all over some research that came out a while ago about cardiovascular and heart attacks and strokes in men. But then they actually had to go into that study and retract all of those statements, which is hilarious because it was a bogus study. So there you go on that. Number 8, this is the biggie. The evidence does not support increased risk of prostate cancer with T therapy. I don't know how much clearer we have to be on that statement right there. And then number 9, the evidence supports a major research initiative to explore possible benefits of T therapy for cardiometabolic disease, including diabetes. So that is the study that all of us should be going by, this World Congress. So you say, okay, Larry, this is an old article. Okay, let's go over here. Boom. So then this is by the same guy, Morgan Taylor, and it says diagnosis and treatment of testosterone deficiency, updated recommendation from the Lisbon 2018 International Consult for Sexual Medicine. So if we go to this article and we look right down here at the conclusions, it says treatment of testosterone deficiency offers multiple benefits for sexual symptoms as well as general health without compelling evidence of increased risk of prostate cancer or cardiovascular events. End of story on that one. So I just showed you the evidence. That's what everybody should be looking at right now in the medical communities. And I'm not sure how this got misconstrued. So if you're a guy and you think you have low testosterone, absolutely seek medical advice and see somebody like me who understands the research and who understands how to create a program for you that's going to maximize the benefits and mitigate any potential risks. That's the key. It needs to be medically managed. I don't recommend anybody doing this stuff on their own. And then if you watch some of my other videos, you can also utilize growth hormone releasing hormones to really upregulate body functions. So symptoms, if you're watching this and you're like, all right, Larry, I don't freaking know if I've got low testosterone, what would some symptoms be where I would need to investigate this? So symptoms of low testosterone can be, brain fog. So foggy thinking, just clarity, sharpness out the window. It can be moodiness. Yeah, us men, we can be moody too. So we can have mood swings up, down, and all around. Mostly it's going to present in fatigue, overwhelming fatigue. You have no will. You don't want to go work out. You don't know why. You've always been a workout person. You have trouble finishing your day. You want to take a nap at night. You can't hardly visit with your kids, with your family in the evening hours. You're snoozing on the couch. So fatigue is a biggie. And then, when you do hit the gym, you're not seeing any results. Your endurance is terrible. You're not gaining any muscle mass. And then, we can have some erectile dysfunction. And I've said this before, this is a real thing. This happens in young men as well as older men. It's not an old man's problem. So if you have low testosterone or high estrogen, you can have erectile dysfunction, which is defined by I can't get an erection, or I can't maintain an erection, or I can't ejaculate or have an orgasm. So those are some of the criteria that I see very, very, very commonly in people that I treat. So I hope this helps. I hope this clears up some of the BS that's out there in regards to testosterone therapy. I thank you for watching this video, and please watch some of my others. I'm going to link some of this research in our blog so that you can read it over or print it out and share it with your medical provider, which I think would be hilarious. So get out there and get optimized, everybody. Thank you for watching this.